A silent threat, 8 signs that could indicate hypertension. Hypertension, medically known as arterial hypertension, and commonly known as high blood pressure, is a common but often overlooked condition where the force of blood against the artery walls is consistently too high. This can lead to serious health issues, such as heart disease, stroke, and even kidney damage. Hypertension is particularly insidious because it can develop over many years without noticeable symptoms, making regular monitoring essential. Historically, the understanding and treatment of hypertension have evolved significantly. Before the 20th century, high blood pressure was not recognized as a medical condition. It wasn't until the early 1900s that doctors began to understand its role in health. The development of the sphygmomanometer, an instrument for measuring blood pressure, was a major breakthrough in this regard. Over the years, as medical science advanced, the significance of controlling hypertension became evident. The advent of antihypertensive medications in the mid-20th century marked a significant turning point, dramatically reducing the risk of stroke and heart disease and highlighting the critical role of modern medicine in managing this silent killer. In most cases, the exact causes of hypertension are not clear, but several factors and conditions may play a role in its development. These include genetics, obesity, lack of physical activity, tobacco use, too much salt in the diet, too little potassium in the diet, alcohol consumption, stress, and certain chronic conditions. Age also plays a significant role, as the risk of hypertension increases as one gets older. One of the most challenging aspects of hypertension is its silent nature. Many people with high blood pressure are not aware of the problem because it may have no warning signs or symptoms. However, some subtle signs can indicate its presence. These signs often go unnoticed or are attributed to other causes, which is why hypertension is often called the silent killer. It's also crucial to understand that having high blood pressure doesn't mean you're tense, nervous, or hyperactive. You can be a calm, relaxed person and still have hypertension. Regular checkups and blood pressure readings are essential for early detection and management. To address this crucial health issue, I will outline the top 8 signs of hypertension in today's video, empowering you to recognize and take action against this silent threat. The first indication of hypertension is often noticed as persistent headaches. These headaches typically occur at the back of the head and are more common in the morning. They arise due to the increased pressure in the blood vessels of the brain, which can lead to a feeling of pulsating or throbbing pain. While occasional headaches are common for various reasons, a consistent pattern of morning headaches should not be overlooked as it could be a sign of elevated blood pressure. The second sign of hypertension can be identified through episodes of visual disturbances. These may include blurred vision, floaters, or occasional flashes of light. The high blood pressure can affect the delicate blood vessels in the eyes, leading to these temporary visual abnormalities. If left unchecked, this could lead to more serious eye conditions, emphasizing the importance of regular eye examinations. Sign 3 of hypertension is the occurrence of nosebleeds. Although nosebleeds can be caused by various factors, frequent and unexplained nosebleeds may be a symptom of high blood pressure. The increased pressure can cause the tiny blood vessels in the nasal lining to rupture more easily, leading to bleeding. Returning to sign number 4, which is the presence of shortness of breath. This symptom often occurs during physical activities or even during rest in severe cases of hypertension. High blood pressure puts extra strain on the heart, which can lead to difficulty in breathing, a condition often mistaken for respiratory issues but can be an important marker of cardiovascular health. Symptom number 5 is palpitations or an increased heart rate. Individuals with hypertension may experience a sensation of their heart beating too hard or fast, even when at rest. This is a response to the heightened blood pressure, and the heart working harder to pump blood through the body. The sixth sign is dizziness or lightheadedness. This can occur when hypertension affects the balance of blood flow to the brain. Although dizziness can have many causes, persistent or severe episodes, especially in conjunction with other symptoms, should prompt a blood pressure check. Sign number 7 is experiencing fatigue or confusion. High blood pressure can lead to decreased oxygen supply to various parts of the body, including the brain. This can result in feelings of tiredness or episodes of confusion, symptoms often overlooked or attributed to stress or lack of sleep. The eighth and final sign is the presence of chest pain or discomfort, particularly during physical activity. This pain, known as angina, is a result of the heart muscle not getting enough oxygen-rich blood due to the high pressure in the arteries. It's a serious sign that requires immediate medical attention as it can indicate underlying heart issues related to hypertension. If you recognize any of these symptoms, it's imperative to consult a healthcare professional. They may recommend a blood pressure monitoring process, often starting with a simple office measurement. However, given that blood pressure can fluctuate throughout the day and in different settings, ambulatory blood pressure monitoring, ABPM, might be suggested. ABPM involves wearing a blood pressure cuff for 24 hours to get a true picture of your blood pressure changes over a day and night. This test is crucial as it can reveal the presence of white coat hypertension, elevated blood pressure in a medical setting, or masked hypertension, normal blood pressure in a medical setting but high elsewhere. For many, hypertension can be managed effectively with lifestyle changes and, if necessary, medication. However, it's important to note that while some individuals may see a reduction in blood pressure levels with these adjustments, others might still require medical intervention. The goal is to find a balance that works for each individual to maintain a healthy blood pressure range. To address hypertension, let's explore 6 lifestyle modifications that can help manage this condition. These changes not only lower blood pressure but also improve overall heart health and reduce the risk of other related diseases. Remember, these modifications are most effective when applied consistently and in conjunction with medical advice. The first modification to consider is adjusting your diet to reduce sodium intake. High sodium levels, commonly found in processed and restaurant foods, can significantly raise blood pressure. Instead, focus on fresh fruits, vegetables, whole grains, and lean proteins. Incorporating potassium-rich foods like bananas, oranges, and potatoes can also help balance sodium levels and manage blood pressure. The second lifestyle change involves regular physical activity. Engaging in moderate exercises like brisk walking, cycling, or swimming for at least 150 minutes per week can lower blood pressure and strengthen your heart. Consistent physical activity helps the heart use oxygen more efficiently, reducing the effort needed to pump blood. Modification number 3 is weight management. Being overweight or obese can increase the risk of hypertension. Losing even a small amount of weight if you're overweight can significantly reduce blood pressure. Focus on a healthy, balanced diet and regular exercise to achieve and maintain a healthy weight. The fourth change is limiting alcohol consumption. While moderate alcohol intake can potentially have some health benefits, excessive drinking can raise blood pressure significantly. It's advisable to limit alcohol to no more than 1 drink a day for women and 2 drinks a day for men. Modification 5 centers on stress management. Chronic stress can contribute to hypertension. Techniques such as deep breathing, meditation, yoga, or even regular leisure activities that you enjoy can help manage stress levels. Additionally, identifying stress triggers and learning to cope with them healthily is crucial. The final lifestyle change involves quitting smoking. Tobacco and nicotine in cigarettes can raise blood pressure and heart rate, narrow arteries, and harden their walls, making your heart work harder. Quitting smoking can improve your heart health significantly, among many other benefits. Adopting these lifestyle modifications can lead to substantial improvements in managing hypertension. However, it's important to remember that these should complement, not replace, any medical treatments prescribed by your healthcare provider. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.